resistant, multi-drug resistant tuberculosis, whereby the drug are not working against the Mycobacterium tuberculosis. As such, we need to change the drug and go to another level of drug, or we see other modality how the patient can be treated. That's how I can say how we diagnose the Mycobacterium tuberculosis.
All right, TB seems that it's a contagious disease. So, Mr. Josham, being a contagious disease, can you tell us some of the risk factors of this disease?
Indeed, it is a contagious infection. Being a contagious infection, it has got some of risk factors or predisposing factors. Number one is malnutrition, where the individual has got poor malnutrition, expecting nothing, but there is a reduction of immunity. If the immunity dwindles, expecting that this infection might take the advantage of dwindling of the immunity as such, and it can easily attack this person, and the person might have the disease. That is number one risk factors. Number two risk is being HIV infection. If an individual has got the HIV infection, we expect that the immunity again it goes down. If the immunity goes down, so this kind of infection may take the advantage and they act as opportunistic infection. As a result, the person might have chance again of developing Mycobacterium tuberculosis of any kind. It can be extrapulmonary or pulmonary, depending on the nature or depending on where this Mycobacterium tuberculosis has infiltrated in high dose amount. In addition to that, another risk it can be being a prisoner. Being a prisoner shall imply that this individual has got high chances of getting the infection, where when the other people there in the prison have got the infection and they have coughed towards their friends and they inhale the aerosols, which when they've been ingested they go directly into upper respiratory tract system, they reach the lungs and attack the alveoli, and that's how the disease will commence. So those are some of the risk factors for Mycobacterium tuberculosis. In addition to that, again, as we were saying in the previous presentation, we said that in polycythemia again, it is another risk again, where people being in a congested site, again the very same rationale I've given already as in prison. Same like in schools, whereby the congestion is very high. Again, it can result into nothing but inhalation might be there, and the result into the development of the Mycobacterium tuberculosis. So those are some of the risk factors, although there are others that are there. However, these are the most prominent one in as far as tuberculosis is concerned.
All right. Now, does this disease TB preventable?
This disease is well preventable. There are various ways that we prevent Mycobacterium tuberculosis. The first way to prevent it is through vaccination. As I was saying during overview, I said that vaccine that much more recommended is Bacillus calmette-guerin, abbreviated as BCG. This vaccine is given to any born baby between the age of 0 up to 14 days. During this period, this baby must be stabbed with that kind of jab, with a name of preventing the Mycobacterium tuberculosis. And for your information, it is known that every individual is born with Mycobacterium tuberculosis, but because of immunity, people they are not suffering from it. That's why again they are supposed to be given vaccine at that age. Number 2 way of preventing is to reduce congestion. Reduce congestion in the following areas: in the prison, in the police cells, in schools, and in other congested areas. When we reduce the congestion, we prevent those people that may have tuberculosis from coughing to their friends. As such, the likelihood of coughing to their friends will be reduced. As such, we'll be able to prevent the disease. As well, there must be a very good way of doing a very good job in prison, especially government must intervene so that the prisons must be well balanced in terms of the capacity as well as the number of people staying there, so as to prevent this kind of infections. So to speak as well of police cells as well as in schools. Number 3 prevention is through we need to check our malnutrition status, whereby individual must have a well balanced diet in all aspect of food type he or she takes. When the nutrition is well balanced, we expect the immunity will be strong enough. As such, this tuberculosis will not be able to attack this individual, and so doing we are preventing it. Again, where the individual has got HIV infection, must comply to his or her treatment so that his or her viral load will be a bit well, so that his immunity will be strong enough. Where immunity is strong, we expect nothing, but the infection might not have the entry point into the body system. As such, we'll be able to prevent this infection of Mycobacterium tuberculosis. In addition to that, again, we need to follow the coughing etiquette. When you are coughing, whichever place we are, we need to cough inside the shoulder, because when we are coughing while holding our hands or inside our hands, we are likely to treat our hands, which when we have the Mycobacterium tuberculosis bacteria, they can easily transmit it to our friend, which again will predispose that person to catching the infection. Again, when we are having the spitting age, when we have the age to spit, we need to spit them in the required place. In this case, we should not just spit anyhow, anywhere, because where we have got those sputum having the Mycobacterium tuberculosis bacteria can easily be transmitted, can be easily inhaled by our friends, of which we are transmitting the infection, which might put us into sporadic of highest in terms of Mycobacterium tuberculosis. Those are some ways how we can be able to prevent this Mycobacterium tuberculosis.
As we are going to an end of this program, today our topic was tuberculosis. In this program, you're with me, Liviness Mtyoga, and my guest today is Mr. Gift Josam, the TB focal. Alright, Mr. Josam, Now, we've talked a lot today. We've discussed the overview of the disease, the clinical manifestation, cause and spread, vaccine testing, exposure, risk factors, prevention. And now, Mr. Joseph, what is the treatment of this disease?
Every disease has got a treatment, other diseases have got no treatment. However, mycobacterial tuberculosis is curable indeed. There are various number of drugs that we use when we want to cure this kind of infection upon being diagnosed. There are 4 drugs that mostly are used in as far as Malawi prescribed medical drugs against mycobacterial tuberculosis.
Okay.
Number 1 drug is ethambutol. Number 2 drug is pyrazimide. Number 3 is isoniazid. Number 5 is streptomycin. However, the first drug that we use, there are 4 drugs of them. They are ethambutol, pyrazimide, and isoniazid. These drugs, they go together. Initially, when we were, or previously, they were given as each. Ethambutol is coming as a tablet on its own. Pyrazimide, the same. Isoniazid, the same. While streptomycin is coming as injectable. Now, because of advancement in terms of science, it has been combined. So, these drugs have been combined only except streptomycin, which is still as injectable. However, the rule of this drug is should be taken on DOT. DOT shall mean direct observation therapy. We need to be observing the patient while she or he is taking medication. We don't want the patient to be hiding medication under the cover of the bed, because if the patient is not taking drugs perfectly, there are very high chances of spreading it to others, which will have the very high number of tuberculosis in our society. As such, the DOT rule was adopted by WHO. And in so doing, when the patient has taken drug for 3 weeks, this patient is liable to be discharged and continue taking drugs at home up to 6 weeks.
Okay, so in this case, you admit the patient.
When the patient has been admitted, this patient, we call them as their contagious infectious patient. They have got mycobacterial tuberculosis in their system. As such, we isolate them, and they are segregated, or they are placed in what we call isolation room. Isolation room or isolation ward. In isolation ward is where they are given these kind of drugs. We don't want them to be mixed together with people who are not of tuberculosis in nature. As such, this patient, they are at isolation ward or TB ward. Most of the time, TB ward is over. When you have got a suspected patient, we put them in TB ward. After diagnosing them, we put them on isolation ward.
Thank you a lot, Mr. Josam, for joining us in this program today. Our listeners, now we come to an end of our Healthy Issues program. As we said that today's topic was tuberculosis, TB. You were with me, Liviness Mchoka, the presenter and the editor of the program, and my guest was Mr. Gift Josam, who is TB Focal from Mulanje District Hospital. Bye.